welcome to Hans van Dulmen. Soft-spoken and understated as he may be, he, to me, is a veritable rock star of CE marking and has made an important difference in many technical files, I would say. So, well, there's a lot more I could say about Hans's reputation, but I'll let him speak for himself, because otherwise I'll just make him blush, I think. Or not, Hans.
Thank you. My name is Hans van Dulmen. I work as a consultant in medical devices, primarily focusing on high-class medical devices, clinical evidence, and the fun world of medical software. I'm going to tell you something about CE marking process, tech files, quality system for software development, standards, all the regs in Europe that we may be faced with while developing and manufacturing an app. So what will be discussed? The discussion, is it a medical device, and if so, on which directive will it fall? Is the MDD product, is it an active implant or is it an IVD? Products can be active implants. For instance, if you have an implant or neurostimulator and if a patient programmer to program the mode of that product and to bring that onto an app, your app will be classified as an active implant medical device with specific requirements. If it is a medical device, what class is it? You have these classes from the medical device directive, class 1, 2A, 2B. So what is it? And the higher the class, the more interaction you will get with your notified body. So basically, class 1 devices would be eligible for self-certification. The higher the class, the more notified body involvement, the more rigid quality system you would need to work with, at least with people. And then deal with the project. What are the practicalities when working on this? Eric and I worked on various projects in this, particularly focusing on the class 1 device. Recently had this class 2A app certified. It was a hearing aid app, the Listen app of the company Kofi, for which we certified the software application as such as a medical hearing aid. So that was quite an interesting project.
What about the hardware?
The hardware, yes. That's true, but that was outward because the product actually ran onto the general platform. And we outruled the platform for that because that was the vehicle on which the software worked. And we used that as a baseline and not interacting with it.
But then everything was off the shelf, so that was why we didn't need to certify it. Describe the dependencies.
It was a CE marked iPhone with a CE marked hearing earpods on it, and there you go.
Was it an cochlear implant or was it an external device?
It's just an app running on your iPhone. Smart hearing aid device.
Okay.
But download it and experience it. Okay, here we go. Is it a medical device? At least to meet the definition of a medical device, as supplemented with the guidance, the MEDEF guidance documents. They give you more insight in how it actually works and how different exams are needed. The directive gives a general description, sometimes difficult to interpret. These guidance documents really help you out in, is it a medical device? And in the case of standalone software, does it qualify as a standalone software? And of course you have these additional guidance documents, which check the block of Eric and he will keep you updated on that. So this is the definition of a medical device. Always dull to read, but still important to read. Any apparatus, including software, used alone or in combination, specifically for diagnostic and or therapeutic purposes, as claimed by the manufacturer to treat these disease profiles. So this is what it boils down to. Is your device a medical device? Does it meet this definition? And this is always important when making a claim for a device. Does it categorize into these, one of these areas? Is it the treatment of a disease, aggravation of a handicap? These, I will see how. The other ones don't apply. I will see how an app would control your conception.
You could have ovulation, fertility.
Oh,
There's
there you go.
some of those.
Yeah.
When they want to have sex. They exist.
Okay. Well, this is the guidance documents. So classification is not always easy. Even Shakespeare struggled with it. It's probably supposed to be or not to be.
Sorry to interrupt, I have a question. Does it matter in any way if the person for whom this is intended in any way interacts with the software? Let's say I develop software and I don't give it to anyone, I don't put it in any app store, I don't distribute it in any way. I just let people give me a file with the ECG, for example, and I use my software to analyze this ECG, and then I get the output and I write the email back to the doctor and say, I looked at it using my own little software program. Is this still a medical device? Because there's no interaction, there's no distribution.
I don't know. So always go back to the definition. So is it is a software you make?
It is software, but only I use it myself.
You use it yourself.
To provide a service, but the service is not using the software. The service is an analysis that I perform myself using my own software.
So you can't do it or someone else can do it.
Yeah.
It's still just
Exactly. The only difference is that you don't put it in the market.
Yeah, right.
Yeah, that's the key issue.
Yes.
You don't have to put it in the market. So that's the difference.
Yeah.
So it is a medical device, but you're not putting it in the market.
So you're saying you don't have to label it? So,
Yeah, it depends. This is the answer that I will give you, but in principle it depends.
You need to certify it. I mean, labeling and certification.
But if you don't, do you place it on the market or do you keep it in your office and not market the product? That's the difference. That you don't need to formally CE mark the product because you do not place it onto the European market. On the other hand, better be sure that it works as it should work.
Exactly. Because you're exposing yourself. to
Yeah,
the-
yeah.
Exactly.
Yeah.
Because the analysis that you do is based on this device.
So you don't rigidly need to end up with a CE mark on your software because you don't place it onto the European market. Still, it needs to meet the criteria of correct analysis of the ECG.
Yeah, and under the new rules, they also have additional criteria for services at a distance. So basically, medical device and service. So even if you don't place it physically on the market, like selling a CD with this device to a physician, if you sell this service as an input for diagnosis to physicians, then I would argue that already you are placing it on the market because you are making it commercially available and because you're incorporated into a service. That's currently, you could have a discussion on whether this is covered, but under the new rules, no doubt this has been completely incorporated in what constitutes placing on the market and making it available.
Okay. Okay, so the classification is something you need to take into account. Basically, it's ticking off the classification rules of the directive and ends up in the class 1, 2A or 2B. Many of the apps are in class 1. Some of the apps which claim class 1 is doubtful whether they actually are class 1 and whether they actually are classified as a medical device. That's the current gray area. Some devices, and I think the VISNet will be even the first, is a class 2A medical device. And then you also have the specific, what Eric discussed, the specific devices, the classification for standalone software. But still, when working on this, and this is important, the classification of the device. What's the claim you want to make? What's the intended use? And in which classification does it run? And that's a delicate, it's an important discussion to have that really clarified as of the beginning of the course, because that determines the route for CE marking. And always have it checked with some sort of third-party expert or whoever, or even take it to your notified body, say, well, this is our classification of the device. From our perspective, this is a class 1 device, would you agree? So I have to check on balance.
Would it be a doctor or a legal?
But it would be one of the many consultants or legal persons in this room.
Okay, so not a doctor.
No, not a doctor. I think this is regulatory legal determination which classifies the medical device. Class 1 devices basically allow for self-certification. The directive allows for these products with a low risk profile, is often said, but I think it's a low vulnerability to harm profile. They can be self-certified. So there you check off the requirements of the directive and say, well, to our perspective, this product meets all the applicable requirements and we bring this product on the market as of tomorrow. There's no third party involved. The higher the class, then the notified body comes in, and then you are mandatory to document compliance to the directive in a technical file, and to have a quality system to structurally design and manufacture. In this case, it is mandatory because the notified body will check on that. In this case, it is highly recommended. What you often see is that basically the class 1 devices allow for self-certification. Is me writing of the declaration of conformity. And the declaration of conformity is just one sentence of paper with a signature below. And if you sign it off, basically you confirm that you meet it. But still, it's more than just this one paper. Still, you need to document that you meet essential requirements, that you have just risk management, that you have just applicable standards. Don't underestimate them. Yes?
It's maybe good to mention that in the Netherlands that we have to notify the EGZ if we have a class 1 device and bring it to the market. So that's a legal obligation according to Dutch law.
And class 1M and 1S. Yes. They fall somewhere in between there, but if they're closer to A and to B in terms of what you need to do as far as I understand.
Yeah, the class 1 devices, basically there's a category, this is the class 1, which is the majority of these products. The 1S, the S stands for sterile. So if you bring a sterile product on the market, there are specific requirements related to the sterility. And if you bring a class 1M device, M stands for measuring, it sets specific requirements for the accuracy of the measurement function. But class 1M devices, if you bring in a measurement function into your app, measuring specific SI values, then this will be a class 1M device, which you would also need to take to the network. Basically, that's okay. This is a scenario which is the route to CE mark. Basically, to the extent you can read, there is this. There are different ways to get your CE mark. Depends on the CE mark here. Basically, the class 1 devices allow for a specific annex to write up your own declaration of conformity, to self-certify the product, and stamp your CE mark yourself on the product. That would apply to the low class medical devices. The higher the class, then you see the notified body gets involved, and there are different routes for CE marking there. And basically, for the class 1 devices, this is the way to go. Then you need to establish a quality system and have your notified body checked if you comply with it. There are different other ways, other categories, but for software, I really wonder if these categories would apply. So basically, this is a full software development is quality system development. You need to develop software in a systematic manner. And that's why you have to have a set of SOPs, how you develop your software, and how to deal with continuous integration of the software, design changes, integration of them. That's process work. And these other annexes allow for type testing, so that you have your software ready and bring the software to a test house, to a notified body, and then they test your software. But what can they test? They can test your user experience. But can you really test the accuracy of the implementation of the software requirement specs? How to deal with it? So these are alternative ways for non-software applications, I think. Actually, I found